Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Vazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, welcome to the Egg Whisperer Show. You guys, I have one of my dearest friends and one of the most famous fertility doctors in the world on today's show, Dr. Julie Lamb. Julie, welcome to today's show.
Thank you so much for having me, Amy.
I am just so honored to have you on today because you're going to be sharing with us your recent publication, the Fertility Experts Guide to Egg Freezing, everything you need to know about putting your fertility on ice. And you guys, every single person out there who's thinking about freezing their eggs needs to get this book from the very start. Don't you think, Julie?
Thank you. Yes, it's exactly what I tell patients every day. So to have it at their fingertips is great.
Exactly. And this is this kind of stuff you want to know at the very beginning, not at the end.
Right. And there's just so much information. It's nice to be able to ingest it at your own pace.
Exactly. So I want to tell people not just a little, but a lot about you before we get into our topic. So Dr. Lamb is a board-certified reproductive endocrinology and infertility specialist at Pacific Northwest Fertility in Seattle. Of course, she graduated top of her medical school class at one of the finest universities, Northwestern, Feinberg School of Medicine in Chicago, and awarded a Fulbright scholarship to study international women's health in Zimbabwe. I didn't know that about you, Julie. She then completed her OB/GYN residency at University of Washington in Seattle and did her fellowship at UCSF, and she is clinical faculty at University of Washington and directs the REI training program for OB/GYN residents and is the director of the Center for Fertility Preservation at Pacific Northwest Fertility. Thank you, Julie, again for coming on. So tell us, why did you write this book?
I wrote this book because I feel like I have so many smart egg freezing patients and there's just so much information out there and it's really hard to piece it together from Google. So to give them a resource that I know is evidence-based and exactly how I would answer their questions. It's just a resource I wanted for my own patients.
And what is egg freezing? I mean, is it just something where you just crack an egg when you're outside when it's really cold and then the egg is frozen? I know I'm just being silly, but what is it?
Yeah, I love it. Actually, when I Google egg freezing, sometimes it comes up with like frozen chicken eggs. It's hilarious. But yes, it's a way to kind of take charge of your fertility. It's certainly not for everybody, but in this book, I kind of give you the 411 on like what to consider when you're thinking about preserving your fertility. So, we spend our whole lives planning for our financial futures, but no one tells you to plan for your fertility future. And I think it's such an important conversation, and I'm hoping to kind of remove some stigma around the discussion so patients can be empowered to learn about their bodies.
And how can fertility preservation really help people?
So it helps people, even though we look young and feel young, the eggs are not as young as we feel and not as healthy as we are. So just because you look young and you're super healthy at 40, as many as 80% of the eggs are abnormal, and as many as half of patients, as you know, have difficulty conceiving by 40. So because of those challenges, you can preserve your fertility earlier in the chance that you might need it in the future. So essentially, if I see somebody in their early to mid 40s that doesn't have eggs left or isn't being successful with their own eggs, that's when we suggest they use the eggs from a younger donor. And it's often somebody that they're not related to. And so this allows you to essentially serve as your own donor in case your eggs aren't working when you're ready to use them. So they're kind of frozen in time. The ovaries age, but the uterus is just as young as you feel. And so they're waiting for you in case you need them in the future.
I love how you phrase that. And for those of you who don't know, Pacific Northwest Fertility has one of the most successful egg banks in the country, if not the world. So what that means is they kind of know how to freeze eggs really well. So for people who are listening to us out there, how do you choose the right clinic? I mean, how do you know that your clinic is top notch when it comes to egg freezing?
That is such an important conversation, Amy. And I think it's something that often goes not discussed. And I think there's a lot of places to freeze your eggs and a lot of people that are willing to do it for you. But you really have to educate yourself on what's behind the scenes. Like, is the embryology lab where they're keeping your eggs or freezing your eggs, do they know how to unfreeze those eggs and making them into embryos? And that's where there's a lot of diversity in the field, and that's what's really hard to tell from like a website or a podcast. And so learning about that and asking your doctor, not only do you feel comfortable with the doctor, because that's certainly number one, you want to have all your questions answered, but number two is like just asking them what are their experiences with using those eggs and what are the success rates at their clinic and their embryology lab in thawing and making them into eggs and causing or embryos and then causing pregnancies.
So I am now picking a clinic and I'm just so confused about what the process is. Can you just run me through the process from start to finish?
Sure. Well, first, I think is reading this book. But I think, a lot of, patients that I meet with come in at all different levels. And there's all sorts of conversations that you can have with patients and empowering them to learn about their fertility. But if you already kind of know and educate yourself, you're going to feel smarter when you're meeting the physician and meeting your team, and you're going to know the questions to ask. And I think that's really important because people that are doing this are all smart. It's just so outside of the way we think about things. So learning about how fertility is tested, what these numbers mean, how it's really important to understand that it doesn't mean you can get pregnant or not. It just tells you, the efficiency of the IVF process and the egg freezing process. So learning a little bit about the process ahead of time helps you really inform yourself, one, to help you decide if it's right for you, but two, to help you ask the right questions so you don't feel as overwhelmed. It just makes the process so much easier. So once you read the book and educate yourself, then you go in, you meet with the physician or the fertility doctor, and you talk about your history. It's actually really detailed. They want to know all sorts of things about you and your health and prior surgeries and your menstrual cycles and your family history, when your mom had her last baby, all the things that kind of impact your fertility. And then we talk to you about the testing, and that's when people tend to glaze over. It's just like so much information, and it's hard to interpret, and it's hard to figure out how it applies to you when you're not even trying to get pregnant. So we talk about the testing. We often do an ultrasound and look at the ovaries because that's one of the ways we can tell what's going on, and that's a transvaginal ultrasound, which can kind of be a little bit scary when you've never had that before. So knowing that that's coming helps you feel prepared and in control. And then you learn about the process. So I usually meet with the patient, do the history, and then we do the testing. And if they haven't read the book, I send them a copy of the book, and we just talk about all the ins and outs and answer their questions. And some people know for sure they want to do it, and some people I meet quite a few times with. And there's no right or wrong answer. It's just figuring out if it's right for you and not waiting until the success rates aren't worth it. So just like informing yourself and empowering yourself so you can figure out like the right plan for you. When you actually start the egg freezing process, which is what you were kind of asking me about, it's kind of a lot. Like it's not fun. It's not the way, you're hoping, to spend your weekends, but it's a series of vaginal ultrasounds and it's a series of injections that help those ovaries grow. And to kind of optimize the process, we follow it with blood work and with ultrasounds. And then once they're about the right size, we actually go in. Since you can't ejaculate your eggs, you have to go in and get them. It's another big gender inequity, in my opinion. So we have to go in and aspirate each little follicle, and with the follicle comes the little egg. And that part is uncomfortable. None of us really like needles in our vaginas. So you go to sleep for about 10 minutes. And during that process, we get the follicular fluid and the embryologist looks under the microscope and gets the eggs out. The recovery is super variable. There's a lot of biological diversity, and patients, some people feel great and go right back to work, and other people feel bloated and uncomfortable for a few days up to even a week. And then you sit down with your doctor again, or with COVID, now we Zoom. It's a lot easier to fit it into your busy day at work. And we talk about like what went well and what were we surprised by and how did you feel and what did we expect, and just kind of have a conversation. What are your family building goals? How long are you going to wait? And kind of figure out is once enough, or do we need to do this again? And how could we optimize that process for that individual? It's very individualized, and that's really important.
I'm still stuck on you can't ejaculate your eggs. I feel like that needs to be a t-shirt, a bumper sticker, a baseball cap. It's so true. So how can you best prepare for egg freezing? I mean, you can Google it, and there's so much stuff out there about how to best prepare. How would you tell your patients to best prepare?
I tell patients to learn about their bodies, learn about their fertility, understand it, make sure they have all their questions answered before they go through the process. I really think that you have to feel like you're doing everything possible to give you a successful cycle. And that helps make the process easier when you're less stressed out. It's not as painful, it's not as hard. So the more knowledge is power. I think other things, improving your nutrition, improving your well-being. So the book talks a little bit about what you can do to kind of clean up your eating and what supplements to take and vitamins and eliminating alcohol and just moderating. A lot of the things we do in our life are probably fine, but you just want to feel like you paid attention. It's a complicated, expensive, when it's out of pocket process, and you want to feel like you did everything possible to make it as successful and as easy for you as possible.
Yeah, and you mentioned, one of the important things to do when you're looking for a clinic is making sure that you feel confident that they can actually thaw your eggs. So when you're ready to conceive, what actually happens then when you're ready to use your eggs?
So I have patients come back and see me when they're ready to talk about using their eggs. And we kind of have like a preconceptual consultation. And we talk about, the age that they froze their eggs, the age that they are now, what their family building goal is. We look at the sperm of their partner, or oftentimes women are doing this on their own with donor sperm or with a female partner. So all of those play into the decision about when to use the eggs and when to optimize natural fertility. So if I have a patient that froze her eggs at 33 and now she's 35, she might have a very good chance of conceiving on her own and be able to save those eggs for a second or third child. So it's always a super individualized conversation. If they froze them at 38 and now they're 43, then it just doesn't make sense. They're so much more successful to use the eggs at a younger age that we make them into embryos and kind of plan the next steps together.
Perfect. And do you have any, not secret, but do you have any special tips for women so that they can get ahead of infertility or stay ahead of it?
I think the number one tip I have is just learning about it, learning what an AMH is, learning about the fertility window. I see so many people that feel young and are healthy, and it just isn't successful for them in their early to mid 40s. And so planning for it and learning about it before you need it, I think, is key. So even if you're not ready to freeze your eggs, if you're 35 and not ready to have a family, learning about how your fertility changes with age so you can plan your future family around that, I think, is my biggest tip. It's just very empowering and, helpful for the future. So there's no right answer, and certainly not everyone should freeze their eggs, but it's nice to have that option. I even have patients that will go out and get a job a year later so it's covered by insurance. So just having that information, who covers it? Would I want to do this? I don't want to try for 5 more years, and I didn't realize that it's hard to get pregnant at 40. So having that information so you can make more informed decisions for yourself is important.
I think a lot of times people are just scared about what's going to happen to them. It's going to cause cancer. It's going to make them feel super bloated. So what can people expect during an egg retrieval, and what can they do during the treatment itself to have the best experience?
That's a great question. So we talk a lot about that in the book, and just kind of like, what can you do to stay hydrated and stay on top of your symptoms? Certainly everyone's so different, and understanding that you don't know how you're going to feel and giving yourself some grace and some leeway. Before the pandemic, I used to tell people to quiet their social schedules and not travel as much and make just more self-care time. And now we all have that. So it's actually a great time to do this because no one's, traveling on the weekends and no one's traveling for work, and it's a little bit easier to fit this into your life. So making space for it in your life and not having such a busy work and social schedule, I have found very helpful for patients. I usually tell people it usually tends to be less physically demanding and more emotionally demanding than they anticipate. So we can help you with the physical part, but doing things to support your emotional well-being, whether it's a therapist or yoga or acupuncture, really dialing into what supports you the best. Exercise, yoga, all the things that help you tolerate stress. And we often tell people to kind of quiet down the exercise. So if you're a big runner, then you need to transition and pivot and find some other stress reduction mechanism that can help you tolerate the process.
I love all the things that you're sharing. And I think having a doctor that you feel a really good connection with, like yourself, I think is really important. Another thing you mentioned, and I know there's a beautiful chart in the book as well, and you talked about doing a post egg freezing consult. How can you tell what the fertility potential of the eggs really is and know if you've frozen enough? How do you guide your patients around that question?
That's probably the hardest part in all of this, is knowing what the reproductive potential is of eggs. So it's much easier to predict. It's much better studied, much more evidence-based to look at the potential of embryos. But when you're not partnered and you're not ready to parent, it's certainly the right thing to do to freeze eggs. But we tend to freeze more than you think you're going to need. And I guess that's probably the key. There's some tools out there, the Brigham and Women's, the Harvard Egg Calculator is based on the current data. I actually extrapolated some of the papers and put it in a chart in the book just to give people a ballpark, but it's more to really make it clear the inefficiencies of the process. Human biology is more inefficient than most patients can ever imagine. And it takes more eggs to make a baby. If you freeze 10 eggs, it just doesn't guarantee a baby. And no matter how many eggs you freeze, you're never going to be 100%. So understanding that it depends on the fertility potential of those eggs that we don't have a test for, the future sperm that you don't know yet, and how all those pieces come together is very different for different patients. And so erring on the side of caution, there's so many things that weigh into how many eggs you want to freeze. And, things like how long you're going to delay. If you're going to wait till you're 45 to conceive, then you need to save a lot more eggs than somebody who's going to, procreate at 38. And it's still a renewable resource where we could go and get more eggs if we needed to. But how many kids you want to have, how open you are to other options for family building. There's a lot of beautiful ways to build a family. And so looking at those too, if you're open to, if your eggs don't work, using a donated egg or a younger sister's egg, then you don't need to save as many as someone who's like, no, biological children are so important to me. So all of those things weigh into it. And I actually have patients play around with the little egg calculators online just to better understand how age affects it. The number affects the success rate. And I think most people are surprised by how low it is. And I think the data is, building, and we're going to have more information soon. There's also more equipoise, like the clinics are getting more leveled out. We don't see as huge of differences between different clinics. So I think in general, egg freezing is becoming not only more popular, but much more successful across the board. And choosing a clinic that's been doing it for a long time and uses a great embryology lab that has good success rates, I think is really important in kind of optimizing your success rates.
If you guys know someone who's thinking about freezing their eggs, you're thinking about freezing your eggs, you guys have to share this episode with them and make sure that you guys get this book. I mean, it's a great read. I read it and learned from it. I tell all my patients about it. And I love that you've created this as a resource for women. And thank you so much for all you're doing, Julie.
Oh, you're so sweet. Thank you so much for saying that. It's my pleasure.
Thank you. Is there anything else you want to add?
No, just don't hesitate to find a doctor you like. I love that you are raising awareness and starting the conversation. There's not just a magic one person. You just have to feel valued and respected and that your questions were answered. And the more you know about the process, the more in tune with your body, and you'll just have a gut feeling if it's right for you. So it's not that you need to do this. It's just that you need to learn more about it to figure out if it's right for you.
Love it. It's always nice to have eggs on ice.
Yes. Everything you need to know about putting your fertility on ice.
Exactly. Oh, there you go. It's always nice to have eggs on ice and everything you know about putting fertility on ice.
Yes. Thank you so much for your help with this book. You're such an inspiration in everything I do. My patients just love your podcasts, and all of your information has just been so helpful and inspiring and empowering to my patients for so many years.
I feel the same about you. Well, thank you guys for tuning in today. I'm going to bring Dr. Lamb on to join us for one of my next egg freezing classes too. So go to eggwhisperschool.com to sign up, and you'll find out which one she'll be joining us at. I hope you'll join us.
Great. I would love to.
Thanks, Julie.
Have a great day. Thank you.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Avazadeh
And you have yet another success story.
just launched by an East Bay fertility doctor.